A heart attack is a serious medical emergency. It occurs when blood flow to the heart muscle is suddenly blocked. This blockage is often caused by a blood clot. Without enough blood, the heart muscle can be damaged or even die. This is why it's critical to act fast if you suspect a heart attack. Myocardial infarction, or MI, is the medical term for a heart attack. It's vital to understand heart attacks because they are a leading cause of death worldwide. However, they are often preventable and treatable, especially with timely intervention and lifestyle changes. Knowing the signs and symptoms of a heart attack can save your life or the life of someone you love. Be aware of the risk factors and talk to your doctor about your heart health. Remember, taking care of your heart is crucial for a long and healthy life. Your heart is an amazing organ. It's about the size of your fist and works tirelessly to pump blood throughout your body. This continuous flow of blood delivers oxygen and nutrients to your cells, keeping you alive and functioning. The heart has 4 chambers, 2 atria on top and 2 ventricles below. The atria receive blood returning to the heart, while the ventricles pump blood out to the body. The coronary arteries are like the heart's own personal plumbing system. They run along the surface of the heart, supplying oxygen-rich blood to the heart muscle itself. When these arteries become blocked, the heart muscle doesn't get the oxygen it needs. This is what happens during a heart attack. Understanding how your heart works can help you appreciate the seriousness of a heart attack and the importance of maintaining a healthy heart. Atherosclerosis is the most common cause of heart attacks. It's a slow, progressive disease that affects the arteries. Over time, plaque builds up inside the artery walls, narrowing the passageway for blood flow. This plaque is made up of cholesterol, fat, calcium, and other substances found in the blood. As plaque grows, it hardens and can rupture. When this happens, a blood clot forms, completely blocking the artery and leading to a heart attack. Atherosclerosis is often called a silent killer because it can develop for years without any noticeable symptoms. Regular checkups and a healthy lifestyle are crucial in detecting and managing this condition. There are 2 types of risk factors for heart attacks: modifiable and non-modifiable. Modifiable risk factors are those you can change through lifestyle choices, while non-modifiable risk factors are those you cannot change. Modifiable risk factors include smoking, high cholesterol, high blood pressure, diabetes, obesity, physical inactivity, and an unhealthy diet. Non-modifiable risk factors include age, family history of heart disease, gender, and race. Men are at higher risk, as are African Americans, Native Americans, and Alaska Natives. While you can't change your genes or your age, you can significantly reduce your risk of a heart attack by adopting a healthy lifestyle and managing modifiable risk factors. Section 5. Recognizing the signs, classic and subtle symptoms. Knowing the signs and symptoms of a heart attack can mean the difference between life and death. While the classic symptom is chest pain, not everyone experiences it the same way. Classic symptoms of a heart attack include chest pain, a feeling of pressure, tightness, squeezing, or pain in the center of the chest that lasts more than a few minutes. Pain radiating to other areas, discomfort spreading to the arms, especially the left arm, back, neck, jaw, or stomach. Shortness of breath, difficulty breathing or catching your breath even when resting. Cold sweats, breaking out in a cold sweat for no apparent reason. Nausea or vomiting, feeling sick to your stomach or throwing up. Subtle symptoms of a heart attack can include unusual fatigue, feeling extremely tired or weak for no apparent reason, lightheadedness or dizziness, feeling faint or unsteady, discomfort in the upper back, a persistent ache or pain between the shoulder blades, pain in the jaw or teeth. Unexplained pain that doesn't seem related to dental problems. It's crucial to remember that heart attack symptoms can vary from person to person. If you experience any of these symptoms, especially if they are severe or persistent, call 911 immediately. Section 6. Diagnosing a heart attack. Tools and tests. Diagnosing a heart attack involves a combination of medical history, physical examination, and diagnostic tests. These tests help doctors confirm the diagnosis and determine the extent of heart damage. Electrocardiogram, or ECG. This test records the electrical activity of your heart and can show if you're having or have had a heart attack. Blood tests. These tests measure levels of cardiac enzymes in your blood, which are released when heart muscle is damaged. Imaging tests, chest X-ray. This imaging test can reveal problems with your lungs and the size and shape of your heart. Echocardiogram. This ultrasound of your heart shows how well your heart chambers are pumping and can detect areas of damage. Coronary angiography. This test uses dye injected into the coronary arteries to visualize blockages using X-ray imaging. Early diagnosis is crucial for effective treatment and better outcomes. The sooner a heart attack is diagnosed and treated, the less damage is likely to occur. Section 7. Treatment options. From medications to procedures. Treatment for a heart attack depends on the severity of the blockage and the extent of heart damage. It often involves a combination of medications and procedures aimed at restoring blood flow to the heart and preventing further damage. Medications, aspirin. This common over-the-counter medication helps prevent blood clots from forming and growing. Thrombolytics. These clot-busting medications dissolve blood clots and restore blood flow to the heart. Nitroglycerin. This medication helps widen blood vessels, improving blood flow to the heart. Beta blockers. These medications slow the heart rate and lower blood pressure, reducing the heart's workload. Procedures. Angioplasty. In this procedure, a balloon is inserted into the blocked artery and inflated to open the blockage. A stent, a small expandable tube, is often placed to keep the artery open. Coronary artery bypass surgery, or CABG. This surgery involves taking a healthy blood vessel from another part of your body and grafting it to bypass the blocked coronary artery. The goal of treatment is to minimize heart damage, relieve symptoms, and prevent future cardiac events. Your doctor will determine the best treatment plan based on your individual needs and medical history. Section 8. Life after a heart attack, recovery and prognosis. Recovering from a heart attack takes time and requires making healthy lifestyle changes. The extent of your recovery depends on the severity of the heart attack and the presence of any underlying conditions. Hospital stay. After a heart attack, you will need to stay in the hospital for a few days for monitoring and treatment. Cardiac rehabilitation. Once you're discharged, you'll likely participate in a cardiac rehabilitation program. This program involves supervised exercise, education on heart-healthy living, and counseling to help you cope with the emotional aspects of having a heart attack. Long-term lifestyle adjustments. Making lasting changes to your lifestyle is crucial for preventing future heart problems. These changes include eating a heart-healthy diet, exercising regularly, quitting smoking, managing stress, taking medications as prescribed. The prognosis after a heart attack varies depending on a number of factors, including the extent of heart damage, age, and overall health. By following your doctor's recommendations and making positive lifestyle changes, you can improve your chances of a successful recovery and reduce your risk of future heart problems. Section 9. Preventing heart attacks. Your heart's best defense. The good news is that many heart attacks are preventable. By taking proactive steps to improve your heart health, you can significantly reduce your risk of developing heart disease. Eat a heart-healthy diet. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated and trans fats, cholesterol, sodium, and added sugars. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Maintain a healthy weight. If you are overweight or obese, losing even a small amount of weight can lower your risk. Don't smoke. Smoking damages your blood vessels and increases your risk of heart attack and stroke. If you smoke, quitting is the single best thing you can do for your heart health. Limit alcohol consumption. If you drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink per day. For women, and up to 2 drinks per day for men. Get regular checkups. See your doctor regularly for blood pressure, cholesterol, and diabetes screenings. Remember, your heart health is in your hands. By making smart choices and adopting a heart-healthy lifestyle, you can protect your heart and live a longer, healthier life. Talk to your doctor about your heart health and what you can do to lower your risk of heart disease.